At the age of 12, I wasn't doing great at school, and I didn't realise for a long time that the reason I was struggling was that I couldn't see. When I did go and get an eye test, with the trial lenses on, I just remember being totally blown away that this world that had been soft suddenly came to this really sharp, vivid focus. In my field, in eye care, there's still a massive gap. At least 1 billion people lack access to the basic eye services that they need and are vision impaired as a consequence. Most of them just need a pair of glasses or a cataract operation. So the issue is not anymore about delivering new innovations, it's about innovating delivery of existing solutions. There's a problem there, and if you're going to overcome it, it's about either moving services closer to the people or providing a way that the people can move to the services, and that for me is the core of our work. When I received the Rolex Award in 2016, we'd completed a programme in schools with our partners in Kenya, where around 20,000 children had been screened and those who required treatment had received it. And we'd built a model that we felt was scalable. The Rolex Award had several impacts, both on me personally and on my organisation. One of the biggest changes in the last couple of years has been that we've moved away from hardware-focused work, so kind of looking at images of the back of the eye and really focusing on identifying those individuals who are currently invisible to ensure that they reach the service that can meet their need, and then tracking whether that service has worked for them. We've gone beyond East Africa. We've started expanding into Southeast Asia, and one of the most exciting programs at the moment is in Pakistan. I mean, what's the population that is now able to access the services? We've got incredible partners there, and they've managed to connect more than 60 different health centres, which are seeing a population of more than 400,000 people. That's just the start. We've chosen difficult places to work, but within that we're choosing the populations in those countries who have the least ability to access or pay for services. So if you get the ingredients right, the potential for change is actually even bigger. Fantastic. So we're talking 30 million people here that we could be reaching. That's hugely exciting. If we just maintain what we're doing now, the numbers of people losing sight are going to triple over the next 30 years. So my ambition is one that is not so much of numbers, but of turning the tide. Can we hit that tipping point where, rather than the numbers going up, we can start to bring them down? There isn't an end to this journey, it's an infinite game. And I think it requires an attitude of better never stops.